Hi guys, welcome to my YouTube channel. My name is Taiwo Black, and in this video we'll be talking about the differences between community pharmacy and hospital pharmacy. So I'm privileged to work in both, and I have some differences that I've observed, and I'll be telling you guys. But I want you to know that the fact that I have said this doesn't mean it applies to all hospitals or all community pharmacies. Yours might be different, or that of others that you have heard of. So if you know any other difference, you can mention it in the comment section. I'll be glad, because our experiences differ and the way we see things are different. So the first difference between community pharmacy and hospital pharmacy is the salary. Hospital pays more than community pharmacy. Why did I say so? Because hospital pharmacists are being paid per their level, their cadre, and the salaries change. While on the other hand, community pharmacy, the salary does not increase. It stays the way you entered the community pharmacy. I mean, the amount you bargain at the beginning of your work, that's what you keep getting. Now, the second difference is the patient interaction. In hospital pharmacy, you do not get to interact with the patient. You don't, because this is Nigeria. Normally, we're supposed to be involved in the clinical activities of patient in the hospital. That is how it should be, but that is not how it is present. On the other hand, community pharmacy, the patient pharmacy interaction is top notch. Like you get to see the patient face to face. The patient complains, lays complaint, and you advise and direct, and you are the one who will choose the drug to use. The working hours in hospital pharmacy, you get to work longer hours compared to community pharmacy. Community pharmacy, you could be doing locum, those are short hours of work, just like I do. But in hospital pharmacy, you get to work longer hours and you get to do shifts, you get to do calls, you run night shift. Hospital pharmacists work longer than community pharmacists. Now, another difference between hospital and community pharmacy is the knowledge. Normally, we should have more knowledge in hospital than in community, but reverse is the case here in Nigeria. In hospital, we're not really involved in the clinical aspect of it, and we're just we don't go for ward round, we don't liaise with the doctor, we really don't know what is happening with the patient. All we know is that they brought prescription to the pharmacy and we are dispensing the drugs. So I would say hospital pharmacy, you will not really get to learn so much based on the clinical activity that we were not doing. But on the other hand, in community pharmacy, you get to learn a lot. You get to see patients, you get to see a lot of diseases, you get to see a lot of cases, you get to see more drugs in community pharmacies. Now, another difference is rotation. In hospital pharmacy, you get rotated from one department to another. It could be in the A&E, it could be in the psychiatric section, it could be in the pediatric section, different sections like that. And you get to see, drugs in that area. While in community pharmacy, you're going to remain in that part. Like, it's the community pharmacy, you're just going to remain there. You're not moving anywhere. Your office is your office. The pharmacy is the pharmacy. There's no other sort of pharmacy there. Another difference is gifts. What I mean, in community pharmacy, you get gifts from your patients, because you have developed this patient pharmacist relationship and they trust you, and helping them, you're checking up on them, they tend to feel appreciative. And sometimes some people, they give you a tip or they come bearing gifts to you. But in the hospital pharmacy, because you've not met them at their dying need, you were just there to dispense drugs, there are really no gifts per se in the hospital pharmacy. So another difference is teamwork. In hospital pharmacy, you get to work with other members of the healthcare system, that is with the nurses, the doctors, physiotherapists, the med lab scientists. You have to work hand in hand with all of these people. But in community pharmacy, there is no teamwork. You are solely the pharmacist. You are the highest cadre. You are the one doing all the brainstorming. You are the one who has all the final say in the pharmacy. No teamwork, just you and you alone as a pharmacist. Now, another difference is relationship with doctors. In hospital pharmacy, you kind of have to develop a good relationship with these doctors, because there are sometimes we see errors in prescription, and you'd have to walk up to tell him or her that there's a mistake here, or you probably notice something that wasn't right in the prescription, and having to go meet them and talk to them nicely you kind of have to, be in good terms with them and be calm, be gentle while telling them that, oh, you don't think this is right. But in community pharmacy, there are no relationship with doctors really, because a lot of prescriptions will come in. You might just be able to place calls through to the doctor. You don't even really need to talk to the doctor. You're not meeting up with any doctor anywhere. But most times in Nigeria, let's not even lie, we don't place calls. Most times you just send the patient back. Please go and return that prescription to the doctor and tell him to review it. Another difference is access to money. In hospital pharmacy, you do not get paid to. There's always a pay point where they bring the receipts before you dispense. So you have nothing to do with the money. Hospital pharmacy, there are no pressure for you to make sales. But in community pharmacy, there's pressure to move sales to a particular level, and in some pharmacies you are the one who attends to the patient directly, collect the money, give the patient change and all of that, but it doesn't happen in all pharmacies. In community pharmacy, there is more workload than in hospital pharmacy, because community pharmacy, you are the one solely doing everything. You're the one brainstorming, you're the one dispensing, you're the one diagnosing. The whole mental stress is really really stressful for you in community pharmacy. But in hospital pharmacy, you just all you do there is just dispense, counsel, do stock and minor things like that, which is not as stressful as working in a community pharmacy. Now guys, thank you for watching. This is the end of the video. I'll see you guys in my next video. Please leave a comment, like this video, subscribe and share to any pharmacy out there who wants to know the difference between pharmacy and hospital pharmacy. Bye guys.